Chemo means chemical, and therapy means treatment. In chemotherapy, doctors give medicine that are meant to destroy cancer. The surgeon's goal is to remove as much of the cancer as possible. Chemotherapy helps destroy those cancer cells that may not have been removed through surgery. In chemotherapy, the medicines are usually given through the vein and sometimes combined with pills, among other methods. The treatments can be given in a number of places, including the hospital inpatient setting, a hospital outpatient department, the doctor's office, and sometimes even at home, administered by the patient or a visiting nurse. Chemotherapy drugs are meant to kill cancer cells, but they can often damage healthy cells as well. Chemotherapy can make patients feel sick. For this reason, doctors do not give patients all the medicine at once. It's too much for the body to handle and could make the patient very sick and weak. This is why chemotherapy is often administered a little bit at a time over a period of 4 to 6 months. Chemotherapy often causes a number of side effects depending on the drugs used and the amounts given. Some possible side effects are nausea and vomiting, mouth sores, vaginal sores, fatigue, and hair loss. New medicines and techniques have helped people tolerate chemotherapy better. Advances have been made in developing more effective combinations of drugs. Side effects such as nausea and vomiting are now better controlled. Some of these medicines can be either given before, during, or after chemotherapy. With these drugs, some people have no nausea or vomiting at all. Certain chemotherapies can make it difficult for a woman to become pregnant, or they can cause a woman's periods to stop before they normally would. Your primary care physician will recommend that you see other doctors who specialize in cancer. These doctors are called oncologists. Do not feel afraid to ask the doctors any questions that you may have. Feel free to get as much information as you need from all your doctors. Women should be sure that their doctor is experienced in cancer and chemotherapy. This is important because medicines, techniques, and research change frequently. There are always new improvements and new information in the field. It's important to be treated by a healthcare team that is up to date on the latest advances. Your healthcare team, which includes your doctor, you, and various specialists, need to work together. Your doctor and oncologist must consider many factors when recommending specific treatment, such as the types of medicine and the doses they prescribe. Don't sit back and let the doctors make these decisions without your input. Ask about your options, their advantages and disadvantages, and possible side effects. Make sure you understand everything clearly. I have previously talked about the hormones, estrogen, and progesterone. Some breast cancers require these hormones to grow. A breast cancer patient's doctor may also recommend hormone therapy, HT. This is not the same thing as birth control, and it's not the same thing as hormone replacement therapy, HRT, which is used when a woman's period stops. Hormone therapy is different. The medicines used in hormone therapy keep the cancer cells from getting the hormones they need to grow, estrogen and progesterone, by suppressing their levels in their body. The cancer will eventually stop growing and shrink when it can't get these hormones. Hormone therapy can be done using several different types of medicines, such as tamoxifen or aromatase inhibitors, AI. For women who still have regular periods, hormone therapy may involve surgery to remove the ovaries. This is because the ovaries produce these hormones. Therefore, removing them reduces the levels in the body. No matter which treatment you choose, you should discuss it thoroughly with your doctor.